actually there is not a single vaccine that we know of that causes autism. The rise in autism is basically because we have changed the diagnosis of autism from what it was before. This is due to something called the DSD manuals that have evolved over time. So no, vaccines don't cause autism. Remember, the whole point of vaccination is to help your immunity fight a particular disease. For you to elicit or for you to develop an immune response for your body to fight this infection, most of the times is that we give the body a weak version of this particular virus or bacteria that we are vaccinating against. And some of the side effects or some of the effects after vaccinations, the most common includes things like fever, temperatures. You could develop a rash, but it's also very important to distinguish whether this is a severe rash that requires a child to be hospitalized. There could be other symptoms such as vomiting, maybe diarrhea. The most common thing is pain on site, which is very common from the injection site, but these are not deemed to be normal. There are side effects and they are what we call adverse events following immunizations. This is now a totally different thing and must be reported. My assumption is that this is in regards to the very recent immunization campaign that went down with the typhoid conjugate vaccine and the measles and rubella vaccine. Now you need to remember that this was not a mandatory campaign that like the oral polio vaccine campaign that was a door-to-door campaign. This is known as a supplementary immunization activity. Now, maybe you might not know this, but the typhoid conjugate vaccine has been there for a while, but it's only been available to those who are privileged to access private facilities and pay for the vaccine at a cost. We never had this in the national immunization program. Two, the reason you do supplementary immunization activities, because sometimes people miss their normal immunization days. Maybe your child fell sick and they're supposed to get a vaccine and they have malaria. So you hold off, and by the time you go back, they haven't received a vaccine. If your child has received all their vaccines and they are up to date, unless explicitly stated that this is an additional or a new version of a vaccine, then you absolutely don't have to be forced to take vaccines again. Being skeptical is a good thing and asking the questions, and we should be able to give you an answer. You shouldn't just accept any kind of injection if you don't know what is in there because you are concerned for your child. But it's very important to also share the proper scientific evidence that we have on why we are vaccinating. Now, immunization is one of the cheapest, cost-effective ways to boost public health, and this has been proven over time. We don't get smallpox anymore. There are people who have never had polio. There are people today, I have never treated a tetanus case. Yet, this is all possible because of the wide vaccination that has been happening over the decades. If you speak to people who were born before the 1970s, the 1960s, especially in low-middle income countries, they will tell you how things were different back then when they didn't have vaccinations. Are we a guinea pig kind of situation in Africa? Unfortunately, because of conspiracy theorists and a lot of things that were done in the past scientifically, especially to black people, when you think of the Tuskegee experiments and things like that, that have really impacted the African Americans in the United States, such articles derive a sense of mistrust. The number one pillar for strong health systems is good leadership and governance. If you don't have a government or a leadership that doesn't invoke trust of its people, then this trickles all the way down. And right now, I can say, frankly, as a pediatrician, I am seeing more and more cases of people being vaccine hesitant or asking a lot about vaccines simply, not because of the science that I present to them, but simply because they said, I don't trust the government. Vaccine is a public health intervention that has been proven to reduce deaths. Everything we vaccinate you against is known as vaccine preventable diseases, meaning that you don't have to die because you can simply get a vaccine and survive. And we can see that from the change in life expectancy as soon as vaccine development has been happening over the years and over the decades. You can see the life expectancy has gone up. You can see the improving of infant mortality and maternal mortality rates thanks to vaccination. So vaccines are very important, because if it's not for vaccines, the COVID pandemic would never have ended. We would still have smallpox, we would still have tetanus, and we would still have so many other vaccine preventable diseases that are causing a lot of deaths.